This segment is sponsored by Muskegon Family Care. Now, this is my own observation, but I think since the pandemic, we've become more comfortable talking about mental health and accepting that therapy is critical to healing. Unfortunately, it seems like there's also been a more intense mental health crisis in this country, so more need for help. Gwen Melton is a behavioral health therapist with Muskegon Family Care, and she joins us now to talk about the rewards of therapy for both patient and provider. It's good to have you here.
Thank you so much. Thanks for having me.
Am I right that we've gotten a little bit more comfortable, but there's so much need?
Oh, absolutely. You're right.
Okay. Well, let's talk a little bit about some of the things that keep people from seeking that help, because there are a lot of issues where people are reluctant.
Absolutely. So in my opinion, I feel like the stigma is still there regarding just therapy in general and going to therapy, and that if you're going to therapy, something has to be completely wrong. And that's not true. When we're struggling, that's a good time to go to therapy, right? You don't have to be underwater. You can be just swimming and paddling and still get that additional support. I think also access. Access is hard. Sometimes cultural, religious factors, things like that play in place too that might
stop somebody from making that decision to pull the trigger and get help. So once you get them there, how do you keep them there too? Because that I know is an issue.
Absolutely. So as a therapist or any therapist, you want to really collaborate your care with that client. Meet them at where they're at. If they're not quite ready for some things, then that's not what we work on. Not only is collaboration important, you have to be able to engage, understand where their strengths are and understand where they want to work on, and really try to help them, support them, so you can kind of gap those two together.
There are so many different types of therapy, and it's not a one-size-fits-all, right? Like, explain some of the different types of therapy that folks can have access to.
Yeah, CBT, which is a cognitive behavioral therapy. That's where your beliefs, emotions, and thoughts, it's the common principle is that they're all related. So if you can change one, a belief, thought, or emotion, you can change the perception, your reaction, and how you feel about something.
So do you spend time with each patient and figure out what type of therapy will work best for them?
Absolutely.
Is that how it is? And sometimes is it trial and error?
Yeah, and sometimes it's a little mix of both. So if somebody's coming in and it might be an immediate problem and they just are wanting a solution, and it's something that maybe is more less complex, you might want to use a brief solution-focused therapy.
What does that mean?
It means that as a therapist, you're going to look at their concern and you're going to work with them like, what's the solution to this? And then we're going to explore how they can get there.
Move toward that. And then there are also therapies like a music therapy, different kinds that can maybe come beside more traditional therapies?
Yeah, so with children, there's play therapy. We use art therapy, and there's also music therapy as well.
And they all work. There's science behind all of that. It's not just let's play a little bit.
Yes, that's right. It's all everything that when you go to a therapist, what they're going to use is going to be evidence-based.
I talked about you getting to know the patient, and the relationship between patient and therapist is critical. So when somebody is in the process of looking for the right fit, what do they look for?
Well, first off, I think when you're looking at a therapist, we have to financially see what's out there for us. So if you have insurance, the first thing to do is to call your insurance company and see what therapists might be in network. There's probably a lot of therapists in your area that are in your network. You can ask your primary care provider if you're not really sure where to go and you want a good referral. There's usually a family member or a friend that's seen somebody, so word of mouth is always good as well.
Is it appropriate for me to ask you for a meet and greet, like that we can sit down and see if you and I are kumbaya, like we are of a like mind?
Absolutely. A lot of places will offer a 15-minute consultation or a meet and greet, and at any time, if you're with a therapist, you have the right to choose what is the best for you and your care. We are servicing you. So if at any time you felt like there was a problem or issue, of course I would say first talk to your therapist to see if it's just a miscommunication, you can get on the same track. But if you feel in the beginning that it's just not the right personality, it's your obligation to yourself to self-advocate and find that therapist that's good for you.
Well, my mom always used to say, I think the greatest gift I could give myself is therapy. And people need to regard it that way, right? It's a path to hope and healing, as you said.
Absolutely.
All right. Well, if you'd like more information or to make an appointment with Muskegon Family Care, you can call the phone number on your screen. It's 231-737-1701 or visit mfc-health.org, and we'll put all that on our website, 13onyourside.com. Thank you so much for being here.
Thank you.